Let me tell you a story I've seen far too many times in my surgical practice. An older patient sits in front of me, rubbing their calves, shifting uncomfortably in the chair. They tell me their legs feel heavy, cold, sometimes numb. Walking to the mailbox feels like a chore. Nights are worse. The feet tingle, sometimes burn, sometimes cramp. And almost always they say the same thing in a quiet, worried voice. Doctor, is this just aging? Is this how it's supposed to be now? If you've ever felt that heaviness in your legs, that poor circulation that makes you dread standing up, I want you to listen very carefully today. Because what I'm about to share is something most people never hear in a doctor's office. Not because it isn't powerful, but because it sounds too simple to be true. Over the years, as a surgeon, I've seen what poor blood flow can slowly do to the legs and feet. I've seen tiny circulation problems turn into chronic pain. I've seen swelling that won't go away. I've seen wounds that heal slowly, numb toes, loss of balance, and fear creeping into daily life. And I've also seen the regret in people's eyes when they say, I wish I had known earlier. Here's the truth most people don't realize. Circulation doesn't suddenly fail overnight. It weakens quietly, gradually, year by year. And long before medications, long before procedures, long before serious intervention is needed, your body is already sending signals. Cold feet, leg fatigue, cramping, discomfort when walking. These are not just normal aging, they are warnings. Now here's where things get interesting. During my years studying blood vessels, inflammation, and tissue healing, I noticed something unexpected. Patients who made certain small dietary choices often had noticeably better circulation in their lower limbs. Their legs stayed warmer. Their walking endurance improved. Their recovery was smoother. And when I looked closer, one specific food kept appearing again and again. It wasn't exotic. It wasn't expensive. It wasn't a supplement with a fancy label. It was a single, everyday nut that many people either ignore or eat without realizing how powerful it can be for blood flow, especially to the legs and feet. Most people think circulation problems can only be fixed with pills, procedures, or compression socks. Some believe once the damage starts, there's nothing you can do. Others fall for myths online, thinking spicy foods or random vitamins alone will magically open arteries. And some simply give up, accepting pain and discomfort as the price of getting older. But what if I told you that one simple nut, when used the right way, can help support healthier blood vessels, improve circulation, and nourish the tiny capillaries that feed your legs and feet? What if I told you this nut works not by forcing your body, but by gently supporting it at the cellular level? In this video, I'm going to explain why circulation in the legs and feet is so vulnerable as we age, what most people are doing wrong without realizing it, and how this one nut plays a unique role in supporting blood flow from the inside out. I'll also explain why timing, portion size, and preparation matter far more than people think. And by the end, you'll understand how to use this knowledge safely, realistically, and in a way that actually fits into your daily life. If you're someone who feels stiffness when you stand up, if your feet feel cold even in warm rooms, if walking longer distances has become harder, or if you simply want to protect your independence and mobility for years to come, this information could change how you look at your health. Stay with me, because in the next part, I'll break down the simple medical logic behind circulation, explain why this nut works when so many other foods don't, and clear up some dangerous myths that may actually be making your leg circulation worse without you even knowing it. When we talk about blood flow to the legs and feet, most people imagine large arteries, strong heartbeats, and pressure pushing blood downward. But the real story is far more delicate than that. In the operating room and in clinic, I've learned that the smallest details often matter the most. Circulation in the lower body depends heavily on the health of tiny blood vessels, the flexibility of vessel walls, and the balance between inflammation and repair inside your body. As we age, blood vessels naturally lose some elasticity. Think of them like an old garden hose. When it's new, water flows easily. Over time, the hose stiffens, tiny cracks form, and flow becomes uneven. In your legs and feet, this matters more than anywhere else, because gravity is already working against you. Blood has to travel down and then fight its way back up, especially when you're standing or walking. Now here's where many myths begin. Some people believe that if their cholesterol numbers look okay, their circulation must be fine. That's not always true. Others think that only people with diabetes or severe artery disease have circulation problems. Again, not true. I've seen patients with no major diagnosis who still suffer from cold feet, leg pain, and fatigue because their microcirculation, The tiniest vessels feeding nerves and muscles is undernourished and inflamed. This is where the nut I mentioned earlier comes into the picture. The nut is the walnut. And before you dismiss that as too simple, let me explain why this matters medically. Walnuts are rich in plant-based omega-3 fatty acids, particularly alpha-linolenic acid. In simple terms, these fats help calm inflammation inside blood vessels. When inflammation is lower, vessel walls relax more easily. Relaxed vessels allow blood to move smoothly instead of struggling through narrow, irritated pathways. This is especially important in the legs and feet, where vessels are smaller and more sensitive to damage. I've seen this play out in real life. One patient, a retired teacher in her late 60s, complained that her legs felt tired after just a short walk. She wasn't overweight. Her labs were decent, but her circulation tests showed sluggish flow in the lower limbs. Along with gentle movement and hydration, we focused on anti-inflammatory foods. Walnuts became part of her routine. Over time, her walking endurance improved. No miracle overnight, but steady, noticeable change. Another reason walnuts stand out is their effect on the inner lining of blood vessels, known as the endothelium. Think of the endothelium as a protective, intelligent layer that tells vessels when to widen and when to narrow. When this lining is damaged by stress, poor diet, or aging, circulation suffers. The nutrients in walnuts support endothelial function, helping vessels respond more effectively to your body's needs. Now let's clear up an important misunderstanding. Eating walnuts does not clog arteries like a pipe cleaner. That's a dangerous myth. What they do is support the environment inside your blood vessels, making them healthier, more flexible, and less inflamed over time. This is how real, sustainable circulation improvement happens. Some people ask, why not just take omega-3 supplements? Supplements can help in some cases, but they lack the full package. Walnuts provide fiber, antioxidants, minerals like magnesium, and compounds that work together. In medicine, we call this synergy. The whole is often more powerful than isolated parts. But here's something crucial many people get wrong. More is not better. I've seen patients snack on large bowls of nuts thinking they're helping themselves, only to experience weight gain, digestive discomfort, and no improvement in circulation. Portion and consistency matter far more than quantity. And there's another myth worth addressing. Some believe that circulation problems are permanent once they start. That mindset alone can rob people of hope. While severe disease needs medical care, many circulation issues in the legs and feet respond beautifully to small, steady changes that support the body, rather than fight it. In the next part, I'm going to show you exactly how to use walnuts the right way. How often, how much, and what to pair them with. I'll also talk about daily habits that either enhance or sabotage blood flow, common mistakes I see in seniors, and how to build a routine that feels doable, not overwhelming. Now let's talk about how to turn this knowledge into something practical, something you can actually use in your daily life without stress or confusion. Because information alone doesn't change health. Gentle, consistent action does. When it comes to walnuts, the goal is not to snack mindlessly, but to use them intentionally. For most seniors, a small handful a day is enough. That's usually about 4 to 6 walnut halves. This amount provides beneficial fats and nutrients without overwhelming your digestion or adding unnecessary calories. I often suggest having them earlier in the day, perhaps with breakfast or as part of a midday meal, because your body tends to use healthy fats more efficiently when you're active. One simple habit I recommend is pairing walnuts with foods that support circulation even further. For example, combining them with leafy greens, berries, or a small portion of plain yogurt can help reduce blood sugar spikes and improve nutrient absorption. This matters because sharp blood sugar swings can damage blood vessels over time, especially in the legs and feet. Hydration is another piece people underestimate. Blood that is slightly dehydrated becomes thicker and moves more slowly. Even mild dehydration can worsen cold feet and leg fatigue. I've seen patients focus on diet while forgetting water, and their progress stalls. A steady intake of fluids throughout the day helps blood flow more smoothly, allowing the benefits of foods like walnuts to actually reach your lower limbs. Movement is equally important, but I want to be very clear here. This is not about intense exercise or painful routines. The legs depend on muscle movement to push blood back toward the heart. Gentle walking, ankle circles, calf raises while holding onto a chair, even seated foot movements can make a meaningful difference. When combined with supportive nutrition, These small actions amplify each other. Now let me talk about common mistakes I see again and again. One is expecting immediate results. Circulation improves gradually. If someone eats walnuts for 3 days and feels nothing, they assume it doesn't work. In reality, blood vessel health changes over weeks, sometimes months. Think of it as nurturing soil before expecting plants to grow. Another mistake is relying on one single food while ignoring other habits that sabotage circulation. Smoking, excessive processed foods, too much salt, and long periods of sitting can undo the benefits of even the healthiest diet. I've had patients who ate all the right foods but sat for hours without moving. Their legs stayed stiff and swollen. The body needs signals, movement, nourishment, and rest working together. There's also fear around fats, especially among older adults who were taught decades ago to avoid them. The truth is, your body needs the right kinds of fats to maintain healthy cell membranes and blood vessels. Walnuts provide fats that support, not harm, circulation when eaten in moderation. One of the most reassuring things I tell my patients is this: you don't have to be perfect. You don't have to overhaul your entire life. You just have to be consistent. A small daily habit done calmly and steadily is far more powerful than big changes done briefly and abandoned. As you build these routines, pay attention to subtle changes. Are your feet warmer at night? Do your legs feel less heavy when you stand up? Can you walk a little farther before needing to rest? These are signs your circulation is responding. In the final part, I want to speak directly to your heart. I want to talk about hope, about reclaiming comfort in your legs and feet, and about why it's never too late to support your body in healing ways. What I'm about to share is something I wish every patient could hear earlier in their journey. Type continue for the final part. If there's one thing I want you to carry with you after watching this, it's this simple truth: your body is not done with you yet. I've seen people in their 70s and 80s regain warmth in their feet, confidence in their steps, and trust in their own bodies again. Not because of a miracle cure, but because they stopped believing it was too late. As a surgeon, I've witnessed both ends of the spectrum. I've seen what happens when circulation continues to decline unchecked, when pain, fear, and limitations slowly shrink a person's world. But I've also seen what happens when someone decides to gently support their body instead of fighting it or giving up on it. The change isn't loud or dramatic. It's quiet, subtle, and deeply powerful. It often starts with something small: a daily handful of walnuts eaten with intention, a glass of water taken before thirst becomes extreme, a short walk that slowly becomes a little longer. These actions may seem insignificant on their own, but together they send a message to your body: you are worth caring for. Blood flow is life. When circulation improves, tissues receive oxygen, nerves wake up, muscles feel stronger, and healing becomes possible again. Warmth returns. Sensation improves. Confidence grows. And with that confidence comes independence, something every senior deserves to protect. I've had patients tell me months later that their favorite change wasn't even the physical improvement. It was the emotional relief, the feeling that they were no longer helpless, that they had some control again, that they could participate in their own healing. If you're listening right now and thinking, this sounds like me, I want you to know you're not alone. Millions of people struggle silently with leg and foot circulation issues. And many never realize that gentle, consistent support can make a real difference. Remember, this isn't about chasing perfection or reversing time. It's about working with your body as it is today. Honoring it, nourishing it, moving it kindly. When you do that, your body often responds in ways that surprise you. If this message resonated with you, take a moment to like this video so more people can hear it. Subscribe to the channel if you want calm, trustworthy guidance that puts your long-term health first. And I'd love to hear from you in the comments. Tell me, have you noticed cold feet, heavy legs, or changes in your circulation? Your story might help someone else feel less alone. Take care of yourself. Your legs carry you through life. They deserve your attention, your patience, and your care.